Now, more than ever, it matters where you get your news. News Radio 1080 KRLD.
The number of new COVID cases keep dropping, but now there's word that long-haul COVID-19 patients are at a much higher risk for heart issues. Dr. Fahmi Farah is a cardiologist at Bentley Heart Medical Center.
We've been seeing vast majority of those especially who are very sick, ill, in the requiring hospitalization and ICU stay. They're getting affected. They're having multi-organ involvement, of course, the lungs because of pneumonia, but also heart. Heart was a big part of the whole complications because many of them we're seeing they're having heart failure, heart attack, arrhythmia issues.
How does this virus attack the heart?
It affects in more than one ways, but one of the root cause we believe has to do with inflammation and also the immune response, the immune surge that it causes can affect the heart by various ways. First of all, by inflammation. It can, for those who have pre-existing heart conditions, such as if they have pre-existing blockages in the heart, even if it's a minor blockage, blockages typically are encapsulated with a film within our vascular system. And if there's an overwhelming immune response or inflammation, it can destabilize that containment of that blockage and can just rupture it, and that can cause heart attack. That's the definition of a heart attack. So it's one way that it's increasing the rate of a heart attack in those who are getting infected, but also it's destabilizing in many the muscle, the heart muscle itself. It's weakening the heart muscle, causing leakage. So that's how people can get fluid built up around the heart. That's causing inflammation of the heart muscle. That's called myocarditis. It can also weaken the heart muscle in general and cause the pump to fail and causing heart failure. So there are more than one pathological pathways how it's affecting the heart.
Myocarditis was a symptom that had come up in the early talks. When we first started getting the vaccine, there was some worry that teenagers, and especially athletic teenagers, were coming down with myocarditis because possibly of the vaccine. So
we have seen a few people being reported with myocarditis after getting the vaccine, but it's very few. When you compare the two groups, those who are vaccinated being, myocarditis being caused by vaccine, to the vast number of people who've been vaccinated and the rate of myocarditis in those population, it's very significant. Insignificant in the vaccination group. So what I'm trying to say is the virus infection itself causes far more myocarditis than the vaccine. So the vaccine is considered to be safe.
The latest trials and the latest results from the vaccine have shown that if you get the vaccine, your long-term risks for issues from COVID are dropped significantly.
That is correct. For those who are vaccinated, they are very well protected from getting ill from the virus. First of all, from getting the virus at all. And then if they do get it, the severity of the illness is far less. Majority of them do not require hospitalization. And the risk of death is certainly minimized with the vaccination group.
If you have a serious case of COVID, how long your heart might be at risk?
From the new study that just came out, we saw that it could be up to more than a year before people can get affected with heart disease, which is really scary because it's not to say that, okay, I'm ill now, and so I'm getting the symptoms of heart failure as a result of that. No, what we're seeing is that these people have recovered, and a year after the recovery, we're discovering that they now have heart disease as a result of the COVID. So the actual impact of how much longer, we really don't know.
Dr. Fahmi Farah, cardiologist at Bentley Heart Medical Center.